If you've been diagnosed with tennis elbow or you're wondering whether you have it, you may be asking yourself whether you need an MRI, an X-ray, or an ultrasound to confirm the diagnosis. The answer surprises a lot of people. In this video, I'll explain when imaging is actually helpful, when it usually isn't necessary, and why MRI findings don't always explain how much pain you're experiencing. By the end of this video, you'll know when imaging is appropriate, what different types of imaging can and can't show, and why we always treat the patient and not the MRI. One of the most common questions I get from patients in clinic is, do I need an MRI to confirm I have tennis elbow? For most people, the answer is no. The vast majority of tennis elbow cases can be accurately diagnosed through a thorough history and a physical examination. In fact, the diagnosis is often made based off where your pain is located, the activities that reproduce your symptoms, and a few simple examination tests performed by your healthcare provider or physical therapist. Because of this, imaging is not routinely recommended for uncomplicated cases of tennis elbow. That being said, imaging does play an important role in certain situations. Your healthcare provider may recommend imaging if your symptoms are unusually severe, you've experienced a significant traumatic injury, you have persistent symptoms that aren't improving with appropriate treatment, or if there's a concern that another condition may be causing your pain. So what can an X-ray show? An X-ray is excellent for looking at bones, but it doesn't show tendons very well. While an X-ray usually appears normal in someone with tennis elbow, it can help rule out other causes of elbow pain, including arthritis, fractures, loose bodies within the joint, or other bony abnormalities. For that reason, your provider may order an X-ray if your symptoms don't fit the typical pattern of tennis elbow, or if another diagnosis is being considered. What about an MRI? Unlike an X-ray, an MRI provides detailed imaging of the body's soft tissues, including tendons, muscles, ligaments, cartilage, and nerves. In people with tennis elbow, an MRI may demonstrate changes within the common extensor tendon, such as tendon thickening, degeneration, or partial tearing. However, it's important to understand something that often surprises patients. An MRI does not always correlate with your symptoms. Many people have tendon changes visible on MRI, but experience little or no pain. At the same time, someone with significant symptoms may have only relatively mild imaging findings. This is why healthcare providers often say, treat the patient and not the MRI. Your symptoms, physical examination, functional limitations, and response to treatment are often much more important than the imaging findings themselves. What about ultrasound? Musculoskeletal ultrasound has become increasingly popular the last few years because it allows healthcare providers to evaluate the tendon in real time. Ultrasound can identify tendon thickening, degenerative changes, partial tears, increased blood flow, or other abnormalities associated with tennis elbow. It also has the advantage of being less expensive than an MRI and allows the examiner to observe the tendon while the elbow is moving. Remember, imaging doesn't change how most people recover. One of the biggest misconceptions is that obtaining an MRI automatically changes the treatment plan when managing tennis elbow. For the majority of people with uncomplicated tennis elbow, it doesn't. Whether your elbow shows mild tendon degeneration or more advanced changes, the foundation of treatment usually remains exactly the same. Managing load, progressively strengthening the tendon, addressing contributing factors throughout the upper extremity, and then finally gradually returning to work, sports, and daily activities. Imaging can provide useful information, but it doesn't replace a thorough clinical examination or a well-designed rehabilitation program. Many people also become worried after reading their imaging report because the wording sounds alarming. It's important to remember that radiology reports are written for healthcare professionals and often describe every finding they see, even if the changes found may not be responsible for your symptoms. The most important question isn't, what did my MRI show? The most important question is, do the imaging findings actually match my symptoms and my physical examination? Your symptoms, your physical examination, and how you respond to treatment are usually much more important than what an MRI or an ultrasound happens to show. The good news is that the vast majority of people with tennis elbow never require advanced imaging and recover successfully without ever needing surgery. If imaging becomes necessary, it should simply be viewed as one piece of the overall picture, not the single factor that determines your diagnosis or your recovery. In the next video, we'll begin the rehabilitation process by walking through beginner exercises designed to reduce pain, improve tendon capacity, and prepare you for progressive loading.